Elevated white blood cell count. A high white blood cell count means there are more infection-fighting cells in your body than usual. What counts as high can be different from one lab to another, depending on the people they serve. When is a high white blood cell count abnormal? Generally for adults, it's considered high if it's over 11,000 white blood cells per microliter of blood. Causes of a high white blood cell count. Several things can cause a high white blood cell count, including infection. Your immune system makes more white blood cells to fight off viruses, bacteria, or fungi. Reaction to medicines. Some medicines, like corticosteroids, can increase white blood cell production. Bone marrow diseases, like leukemia, which causes too many white blood cells to be made. Immune system disorders, such as rheumatoid arthritis and sarcoidosis. Sudden stress. Intense exercise or emotional stress can temporarily increase your white blood cell count. Smoking. Smoking makes your immune system work harder, which can lead to a higher white blood cell count. Medical conditions associated with a high white blood cell count. A high white blood cell count can be linked to several conditions including allergies, especially severe allergic reactions, asthma, bacterial, viral, fungal, or parasitic infections, burns, where the body makes more white blood cells to fight infection, Churg-Strauss syndrome, a rare immune disorder, use of certain medications such as corticosteroids and epinephrine, hay fever or allergic rhinitis, leukemia, lymphoma, myelofibrosis, a bone marrow disorder, polycythemia vera, a disorder that increases blood cell production, pregnancy, where a normal increase in white blood cells can occur, rheumatoid arthritis, which can cause an increase in white blood cells due to chronic inflammation, sarcoidosis, an inflammatory disorder that causes abnormal clumps of inflammatory cells to grow, smoking, as it constantly stimulates the immune system, tuberculosis, TB, a bacterial infection that affects the lungs, vasculitis, whooping cough, a contagious disease that causes inflammation of the respiratory system. When should you see a doctor? A high white blood cell count can be found through lab tests your doctor orders. Sometimes it's found by accident during a routine checkup. If your tests show a high white blood cell count, it's important to talk to your doctor to find out why. Based on the results, your doctor may recommend more tests to get a better diagnosis and find the underlying cause.